Have you ever wondered why treating something like a simple eye infection can be so complicated? Well, it's because the eye isn't just a window to the soul, it's a fortress, a heavily guarded one, brilliantly designed to keep everything out. And that, of course, includes the very medicine we're trying to get in. So today, let's figure out how to breach those walls.
So yeah, this is the big question, right? It doesn't matter if it's for you or your dog or your cat, getting medicine to actually work inside the eye is a huge pharmacological challenge. And the answer? Well, it all comes down to the eye's incredible, and I mean incredible, natural defense systems.
I really want you to hold on to this idea as we go through this. The eye as a fortress. Seriously, it has walls, it has moats, it has security gates, all of them working 24/7 to protect the delicate stuff inside that lets us see. The only problem is, these defenses can't tell the difference between a dangerous bacteria and a helpful antibiotic. To them, everything is an invader. Okay, so to really understand the problem, we need to know a little bit about the fortress itself. You've got the eyelids on the outside, obviously, but on the inside, the eye is built in 3 main layers. Think of it as an outer wall, a middle layer with all the plumbing, and then the really important neural tissue at the very back. Each one of these plays a role in its defense.
So let's get specific about these walls that stop drugs dead in their tracks. We're really up against 2 main types of barriers. First, there's the physical outer wall. That's the cornea. And second, there's this internal security system, the blood-ocular barriers.
Now, this is where it gets really interesting. The cornea isn't just one simple layer. You have to think of it like a security sandwich. The outer layer loves fatty things. It's lipophilic. The really thick middle layer loves water. That's hydrophilic. And then the inner layer, back to loving fats. So for any topical drug to get through, it has to be able to sneak past all 3, which is just incredibly tricky.
And even if a drug manages to get into the bloodstream, it's not home free, not at all. Inside, the eye has these moats, the blood aqueous and the blood retinal barriers. Their whole job is to keep the eye's fluids crystal clear so vision isn't blurry, and they do that by stopping almost anything from the blood from getting in. This is a massive roadblock for any medication you take by mouth or by injection.
Okay, so we've established the eye is a fortress. So how do we get the keys? Well, this is where the clever part comes in. Pharmacologists have figured out some pretty smart strategies to basically sneak medication past the guards. It's all about crafting the perfect key to fit the right lock. So what does this perfect key look like? Well, it basically has to be a master of disguise. To get through that corneal sandwich we talked about, it needs to be biphasic, meaning it's comfortable in both fatty and watery environments. Then, to cross those internal blood barriers, it helps to be lipid-soluble or fat-loving, and it has to be small, have a low molecular weight. So small and adaptable is the name of the game. You know, even the form of the drug makes a huge difference. You've got solutions, which are basically medicated water. They're super easy to put in, but they get washed out by tears almost immediately. Then you've got ointments, which are greasy. They stick around a lot longer, which is great, but they can be messy and can even blur a vision for a bit. It's always a trade-off.
So putting all this together, understanding the barriers, understanding the drug types, this is exactly what helps veterinarians choose the right attack plan. The route you take depends entirely on which part of the fortress you need to get to. If the problem is right on the surface, say a corneal ulcer or a case of pink eye, then topical drops or ointments are absolutely the way to go. You get a high dose right where you need it, at the very front of the eye, and you minimize how much of the drug gets into the rest of the body.
But what if the problem is deep inside, like with the retina, or in the tissues around the eye, like the eyelids? Well, topical drops are never going to get there. For that, you need a systemic approach, pills or injections that travel through the bloodstream to reach those deeper parts of the fortress.
And for the really severe conditions, you have the most direct approach of all, injections. We're talking right into or around the eye itself. An intravitreal injection, for example, puts the drug right into the main jelly-like cavity of the eye. It's definitely a high-risk, high-reward strategy, so it's only used when absolutely necessary. Okay, let's see how all this theory works in a real-world scenario. A really common and very serious problem in veterinary medicine is glaucoma. That's high pressure inside the eye. And managing it is a perfect example of all the challenges and strategies we've been talking about. This table pretty much shows the main arsenal of topical drugs used to lower that eye pressure. You've got different classes, like beta blockers and prostaglandin analogs. You can see they're given at different frequencies, some twice a day, some more. But the column I really want you to pay attention to is the last one, contraindications. That tells us when we should absolutely not use these drugs. Let's really focus on this one for a second, because it is so important. Even though a drug like timolol is just an eye drop, some of it can get absorbed into the bloodstream and affect the entire body. So for a pet that has asthma or heart disease, giving a beta blocker eye drop could actually be dangerous. It just goes to show you a vet needs to know the patient's full medical history, not just what's wrong with their eye. And it gets even more specific. See, some types of glaucoma are caused by inflammation or the lens getting pushed forward, which physically blocks fluid from draining. If you use one of these drugs in that situation, they can make the pupil smaller and actually make the blockage even worse. It's a critical lesson. You have to know the cause of the glaucoma before you can pick the right drug to treat it. And here is a fantastic, practical little fact for you. That little space between the eyelids in a dog or cat, it can only hold about 30 microliters of fluid. Now, a single drop from most bottles is often more than that. So what does that mean? It means if you put 2 drops in at once, that second one is almost guaranteed to just spill right out and be completely wasted. It's a perfect example of how even the simplest part of treatment needs some real know-how. So we've seen how the eye is this incredible fortress, and we've seen the clever keys and attack plans we've designed to get medicine inside. But it is still a huge challenge. And that leaves us with one final thought. What's next? With technology moving so fast, what could be on the horizon? Could things like nanotechnology or maybe drug-releasing contact lenses finally give us the master key to the fortress of the eye?